Back in July 1978, first test tube baby Louis Brown was born. This gave hope to millions of childless couples, and since then, almost 8 million babies have been born through some kind of artificial reproductive technology. Hello everyone, this is Dr. Sumina bringing you greetings. Today, we'll talk about IVF or in vitro fertilization. This is also known as test tube baby procedure. It is a procedure in which the egg and the sperm are combined outside the body. The egg is fertilized outside the body and the fertilized egg later is implanted in the uterus. So anything which is happening outside the body is called in vitro and anything which happens inside the body is called in vivo. Hence the term in vitro fertilization. Who should opt for IVF? Number 1 is the tubal factor, which means problems in the fallopian tubes. In case the tubes are bad or they are blocked because of some previous infections, surgeries or endometriosis, the fertilization will not be possible and therefore IVF is needed. Second reason is male factor, which means less sperm count, less sperm concentration and low motility, less of normal forms in the sperms, and IUI has failed number of times. Obviously now the next option is IVF. The third cause is ovulation disorder, which means in case the ovulation is not happening regularly or it is completely absent due to severe polycystic ovaries, then of course in IVF we have a controlled and programmed ovulation which makes pregnancy rates better. Fourth is unexplained infertility, which means everything is fine with both wife and husband, still the pregnancy is not happening. They have been trying multiple treatments without success. Then IVF is the next logical step to be taken. Fifth, in case somebody has undergone a fertility preservation or egg freezing because unfortunately they were diagnosed with some kind of cancer that required chemotherapy or radiation, or freezing was done because of some social reasons like career or a family history of premature menopause. So post egg freezing or sperm freezing, pregnancy is possible only through IVF. Sixth, in case there is a problem in the mother's uterus or the pregnancy poses a serious health risk to the mother, in that cases, mother's eggs are removed, they are fertilized with father's sperms outside the body, and now the fertilized egg or embryo is deposited into somebody else's uterus. This is called as gestational surrogacy and it is possible only through IVF. So, now let us understand how is IVF done. Basically, IVF has 6 steps. Number 1 is counseling. Second is ovarian stimulation or egg growth. Third is egg pickup or oocyte pickup. Fourth is semen collection or sperm collection. Fifth is fertilization or ICSI, that is injecting sperm into egg and culturing it in the laboratory to form an embryo. Sixth is embryo transfer back into the uterus. Okay, now let's talk about each one of them in detail. The first is counseling. Infertility treatments including IVF and ICSI are mentally, physically, emotionally and financially very taxing. So make sure that you have spoken to your doctor about all the small and big in detail. Second is ovulation stimulation. The ovaries are stimulated with fertility drugs known as gonadotropins. These are hormone medicines. It takes on an average 9 to 12 days for the eggs to grow to mature size. Then the next step is egg or oocyte retrieval or egg pickup. So for this, usually the patient is admitted in the hospital. It is done under anesthesia. An ultrasound probe is inserted into the vagina to locate those developing follicles. A fine needle is then guided under ultrasound guidance into the follicles and the eggs are sucked out into the laboratory. They are aspirated out and immediately examined in the lab under a microscope. The next step is semen collection. So, at that very time, the partner or husband is asked to give his sperms. Then, the egg and sperm are combined together in the laboratory. The semen sample can also be frozen sample in case there is severe paucity of the number of sperms or if they had to be extracted surgically at some other point of time. And nowadays, in most cases, ICSI, that stands for intracytoplasmic sperm injection, is done, in which a single sperm is actually picked up and put inside the egg. After that, once the fertilization happens, the fertilized egg is then monitored for its growth. Now, the fertilized egg, just known as embryo, is deposited back into the uterus. This is known as embryo transfer. Post-embryo transfer, usually very basic care is advised, which means that you may be expected to have a little bit of soreness, a little bit of heaviness in your abdomen. You might have a little cramping or spotting. You might be given certain medications to support the pregnancy, and typically 2 weeks later, the doctor orders a test which is known as beta HCG in your blood to confirm the pregnancy. The most important question is, what is the success rate for IVF? So, the IVF success rate depends upon number of factors such as the age of the partners, both mother and the father, the reason for infertility, whether own eggs and sperms were used or a donor egg and a donor sperm was used, whether it was fresh egg and fresh sperm or it was frozen egg and frozen sperm, and also where the procedure happened. And in most of the cases, in age less than 35 years, most of the good centers claim a success rate to be around 40 to 50%. So it is very important to seek treatment from the right sources. I know IVF is a very big topic. In today's video, we have just covered the basics. So if you have any questions about IVF, I would be very happy to answer them. Please leave your questions in the comment box below.